Hello, I'm Victoria Delgado from Barcelona, and I'm here at the PCR London Valves together with Nina Wunderlich from Germany. We are two experienced imagers, but not so experienced because at this Congress we have learned a lot. And we have learned a lot particularly on the tricuspid valve. That is a valve that was kind of forgotten, but we see more and more that we have many more devices to treat it, and we need to learn to improve our skills on imaging. So Nina, tell us a little bit more about what was here at the London Valves about the tricuspid valve. What have we learned?
I mean, Victoria, you already mentioned, the most important thing is it's not anymore on the shadow, so it's in the focus. We learned that tricuspid regurgitation is an independent predictor for mortality in the scenario of many valve disease. So it's getting really important that we take care of this valve. So in my eyes, what was a really step forward during this meeting is we implemented again the Imaging Learning Center, which is a really important step to get awareness about the imaging of the tricuspid valve. And there was another thing I really liked because we wanted to highlight a little bit more the role of the imaging during the interventions, and that many of the decisions during intervention, they are all based on imaging actually, and that this becomes a little bit more focus and a little bit more highlighted during the live cases.
Indeed, and it's not only one imaging technique because we need to have the combination, and the simulation lab and the imaging learning center help us in a way. They were always packed, and I can understand why, but help us to understand the integration of the different imaging techniques. One specific topic where you really need this integration is in patients with tricuspid regurgitation due to pacemaker leads, or patients that have pacemaker leads, and these are many patients. This is also a specific topic that sometimes we have doubts whether they can be treated or not. Is there anything new about this topic there?
Well, I think it's a really important topic because we know that a lot of our patients we are treating have pacemaker leads. And in some of the patients, the pacemaker lead is just a bystander, but in many of the patients, it's a cause for the tricuspid regurgitation. So it's of major importance to standardize the nomenclature in patients with pacemaker leads. And I think there was a big step forward because coming from the tricuspid, from the PCR tricuspid focus group, there was a paper, it's on the process of publication,
yes.
And this is dealing with the subject, and I think we can learn a lot, and it summarizes the major topics around pacemaker leads in patients with tricuspid regurgitation.
And do you think that these patients will be suitable for the new device that we have recently with a CE mark that is for a tricuspid valve implantation? Will this be an issue for that? What was the forum talking about this new valve? Which are the characteristics?
Well, yeah, fortunately, so we broadened our options for treatment, and I think this is the first and most important thing. So we are able nowadays, with a first device that has CE mark, to do an interventional replacement of the tricuspid valve, which is exceptional, and everybody is very excited about it. And so this would broaden the options for the patients, and especially for patients who may not be suitable for other interventional treatment options, for example, like a TARE procedure or an annuloplasty device. So this is an option for those patients. You asked specifically if this is treatable if you have a pacemaker lead in the tricuspid space. Yeah, it seems to be suitable. You can do it, but we need a lot more experience. We need data on that. But it's a very exciting field that is going to open right now, and I think we really can look forward and learn from these new experiences.
Indeed, and you mentioned also the PCR tricuspid focus group. That is a very important group, multidisciplinary, where there have been very important initiatives to reach more cardiologists, to increase awareness about the tricuspid valve, to increase awareness about the different possibilities that we have now for treating patients with tricuspid regurgitation. Which are the new initiatives that we may see in the future from this group?
Well, yeah, I think the group is very active. Yeah, this is something which is really good. And the new activities, there have been a lot of activities during the last year. So there have been a couple of webinars on specific topics, for example, like you already mentioned, on pacemaker-related tricuspid regurgitation. So we had webinars on specific topics like to illuminate data. So a lot of activities going on into webinars, and so we also have a couple of referral meetings locally, spread all over Europe, which is really good because the point right now we have to take care of is that we have awareness of the disease. And this is not done in the cardiology community right here at London Valves, so you have to bring this information and the idea and the awareness, you have to bring that out into the field.
This is very important, Nina. You said the word, we need to increase the awareness, we need to increase the community, the connections, and I think that this meeting, London Valves, is one of the landmark meetings in order to connect with the community and have new initiatives to reach out more physicians, more specialists that will give the best diagnosis and treatment options for patients with tricuspid regurgitation. I thank you very much, Nina, for this conversation, and I hope to see you soon.